I invite Dr. Manvi Deokrishna for our talk on enhanced patient follow-up in ophthalmology, insight from the SHARP project. You can start, madam.
Every day, we are bombarded with an emotional message in the form of various advertisements, while being a finger click away from a world of technical knowledge. An emotional appeal or technical information. When it comes to patient counseling, which of these fares better? Let us take a look at enhancing patient follow-up in ophthalmology, insights from the SHARP project. Certain conditions in vitreoretina need an emergency treatment, and a delay can result in very dismal outcomes. In the subjective high-risk patient randomization project, we looked at interventions to improve follow-up in high-risk cases by using an emotional appeal or by imparting technical knowledge. We recruited patients who were treatment naive with proliferative diabetic retinopathy scheduled for pan-retinal photocoagulation, those with retinal detachment for surgery, and those with neovascular age-related macular degeneration for anti-VEGF injection. After evaluation by a retinal consultant and diagnosis with these three conditions, the patients were directed to a study coordinator who then administered a consent and randomized them into 3 arms. Patients in the base arm received the regular counseling by the departmental counselor, as is the routine protocol at our institute. Patients in the emotional arm viewed an emotional video which depicted an elderly gentleman who had lost his vision due to delaying care. Following this, they also received the regular base counseling, as is the institutional protocol. Patients in the technical arm viewed a disease-specific technical video. These videos briefly highlighted the pathogenesis of each disease and also explained the modality of treatment in a simple language for patient understanding. Following viewing the technical video, these patients also underwent the usual base counseling. At the end of this session, a questionnaire was administered to gauge their emotional response, and we tracked the next 3 patient visits. This prospective randomized controlled trial was carried out from March 2018 to December 2023 and recruited a total of 2,100 patients who were equally distributed across the 3 arms. This equivalent distribution was seen also across the 3 disease categories, with the maximum number of patients having proliferative diabetic retinopathy. When we look up at the show-up probability, the patients randomized to the emotional arm had a better show-up probability than the base arm. This was maintained across the 3 disease categories, with patients in retinal detachment also having an edge on viewing the technical video. Patients who saw the emotional video experienced more fear, sadness, anxiety, and disgust, while those seeing the technical video experienced more of anger. Every day we are exposed to numerous emotional messages, altering our perceptions and shaping our decisions. We found that an emotional appeal is more potent in improving patient follow-up. In SHARP, we chose to have an emotional video with a negative message, since most vitreoretinal conditions tend to have a guarded visual outcome. These findings are in alignment with previous successes of emotional messages when it comes to preventive behavior for cancer or in addressing environmental issues. Technical information can be pivotal and has shown success in prior various studies, like along with cataract consent administration, comprehending anticoagulant use, or for parents to understand pediatric uveitis. On one hand, the emotional video correctly underscored the gravity of delaying treatment by eliciting fear, sadness, anxiety, and disgust. These feelings brought about the feeling of potential loss of vision from delaying care. The technical video provoked anger, possibly from frustration of not understanding one's disease condition. In conclusion, the SHARP study proves that patients who are approached with an emotional appeal are more likely to adhere to in-time patient appointments despite the negative emotions provoked. These interventions transcend ophthalmology, and so these findings can be applied to any field of medicine. Improving follow-up can foster a better healthcare system and be the silver lining that the healthcare requires. Thank you.
Would you like to
Thank you so much. Thank you.
Thank you.
Okay.
Thank you so